So good evening, everybody. I hope my slides are visible.
Yes, sir, they are.
So at the outset, thank you, Amol. Thank you, Dr. Nikhil, for giving me this opportunity. I will be speaking about the early results of the Pacific R trial, which evaluated the real-world characteristics of unresectable stage 3 NSCLC patients treated with durvalumab after chemoradiotherapy. So based on the phase 3 Pacific trial data, we know that treatment with durvalumab for up to 12 months is now, which is known as the Pacific regimen, has become the standard of care in patients with unresectable stage 3 NSCLC who have not progressed following the initial platinum-based chemoradiation therapy. This trial has shown a 4-year overall survival of almost 4 years. However, insights on the treatment and clinical outcomes for patients receiving immunotherapy in a real-world setting are needed. So to assess the effectiveness of durvalumab in this patient population in a real-life setting, the Pacific R study enrolled patients who had received durvalumab in an extended access program, which was initiated by AstraZeneca, who has this molecule of durvalumab. So the baseline characteristics of the full cohort of patients enrolled in this Pacific R study, as well as the preliminary safety data, was reported in the ELCC this year. So according to the study design, patients who were eligible had to have unresectable stage 3 NSCLC regardless of their tumor PD-L1 expression, and they had to have no evidence of disease progression following either definitive or sequential chemoradiotherapy. These patients were started on durvalumab at 10 mg per kg given intravenously every 2 weeks. The data were extracted from patients' medical records for retrospective data collection at different time points. So this is basically a 5-year observation study to evaluate the disease evolution, and this is an ongoing study. The primary endpoint is investigator-assessed PFS and OS. The key secondary endpoints are demographics, disease characteristics, prior therapy, PFS and OS by subgroups, and adverse events of special interest. So coming to baseline characteristics, 1,193 patients were enrolled in 254 active sites in 10 participating countries. Out of this, 1,155 patients were found to be eligible and were included in the FAS, that is the full analysis set. So the participating countries were France, Australia, Netherlands, Belgium, Italy, Israel, Germany, Norway, UK, and Switzerland. Most of the patients were contributed from France. The notable baseline comorbidities were hypertension, seen in 30% of patients, COPD, seen in 25% of patients, diabetes and cardiovascular disease, each seen in around 12 to 13% of patients. This is the first important highlight of this real-world data, which showed that 76.8% of patients received concurrent radiotherapy, but there were 14.6% of patients who received sequential chemoradiotherapy as against in the primary trial, and 8.6% of patients received treatment as an other regimen. If you look at the total FAS population, which is listed in the last column of this table, the median age was 65 years. Most of the patients were male. 65% of the patients were former smokers. Majority of the patients, that is 95%, had a stage 3 NSCLC as their initial diagnosis, and more than 50% of patients, that is 57.5%, had adenocarcinoma as their histology. If you look at the concurrent and the sequential chemoradiotherapy cohorts, there were no significant differences in the baseline characteristics except for two things. More patients in the sequential chemoradiotherapy arm had an age of more than 70 years, 37% versus 28%, and more patients in the sequential chemoradiotherapy arm had a primary tumor diameter of more than 7 centimeters, 25% versus 15.8%. So this basically reflects how we treat these patients in the real world as well. Additionally, 68.6% of patients were tested for PD-L1 expression. Majority of the patients had a PD-L1 expression of at least 1% or more, as compared to 17.4% of patients having a PD-L1 expression of less than 1%. 10% of patients' PD-L1 expression was not clearly reported. There were no significant differences in the baseline characteristics by the PD-L1 expression level as noted. Coming to the CRT regimens by country, the median total radiation therapy dose was 65 gray. The median total RT duration was 6.4 weeks, which concurred with the standard treatment. The second important highlight of this study was this, that the median time from completion of radiotherapy to the start of durvalumab treatment was 52 days. That is, in the real world setting, there was a delay in the start of durvalumab treatment after radiation therapy. The platinum-based chemotherapy radiation regimens also varied by country. Vinorelbine was the favored partner in France, Germany, and UK, while paclitaxel was used more in Australia and Israel. Etoposide was the most used option in Netherlands, Belgium, and Norway. The median chemotherapy duration was 7.1 weeks. In Italy, it was noted that the proportions were similar between concurrent, and in Norway, it was mandatory that all patients had to have received concurrent chemoradiotherapy. So the predefined adverse events of special interest occurring in the first 3 months of durvalumab treatment were as follows. The most common, as noted in the primary trial, was also pneumonitis, which was seen in 10.6% of patients, and almost 4.8% of the patients had to have a permanent discontinuation of their durvalumab treatment because of this side effect. Endocrinopathy was another noted side effect seen in 6.8% of patients, but this was unlikely to result in permanent treatment discontinuation. So to conclude, this real-world study highlights two important differences between the real-world population and that seen in the Pacific. In the real world, more patients are likely to receive a sequential chemoradiotherapy than concurrent chemoradiotherapy, and there is likely to be a more delayed time to durvalumab start from completion of chemoradiotherapy in the real-world setting. This is important because exploratory analysis of the Pacific trial highlighted that patients who start treatment with durvalumab within 14 days after completion of radiotherapy have improved efficacy outcomes compared with those who start treatment more than 14 days from the completion of radiotherapy. But however, there is a French study of around 600 patients which showed that despite a delay in the start of durvalumab treatment, there was no impact on the survival outcomes. So we'll have to wait for the results of this study. And if we have the similar results, then it will give us confidence in treating these patients with durvalumab in the real world setting. Pneumonitis was the most commonly reported adverse event of special interest in the first 3 months of this treatment, which was observed in around 10% of patients, leading to permanent discontinuation in about half of the patients experiencing this adverse event. And we have to be careful about this side effect. So the future analysis of this ongoing study will focus on PFS, OS, and the duration of durvalumab treatment. Thank you.